So what about, you're in a small, tight-knit community.
Right.
Most everybody knows each other. Your kids can probably bike all around town
right.
without a whole lot of worry.
Right.
And so you've got a sense of who's in the community. Would you dare say that there are a lot of folks in your community with prediabetes or diabetes that's yet to be diagnosed? Have
Absolutely.
you talked about, as a community, how you might address that?
Sure, and so that's something that's actually pertinent right now. We're looking into ways that we can not only visit with these patients and screen for prediabetes, but do referrals to our local prescribers to say, hey, these are people that we need to get in the pipeline right now. You know, one of the challenges in poor rural areas is what's the expense, what's it going to cost, and so on. And then from the pharmacist perspective, you know, how are we reimbursed for our time in those assessments and referrals and so forth. But yeah, it's a big deal.
So how many times have you, what proportion of the time might you have a chief complaint of X and end the conversation with that patient and that visit with, and oh, by the way, you have diabetes and we're going to start this journey together?
Well, it happens quite often, actually. So part of the beauty of being in internal medicine practice is seeing patients regularly over years and years and years. So you start to see some of these changes that trigger alarms and the need for more aggressive control, especially with the prediabetes, because it's actually in epidemic proportions right now, according to the World Health Organization, where we're starting to see more and more diabetics being diagnosed. So I think in those patients that have prediabetes, and I believe that there is an increase in public messaging concerning prediabetes, I think it's about implementation of appropriate lifestyle intervention. And even if we were to consider pharmacotherapy in the pre-diabetic patient, there are only certain agents that have been recommended according to the American Association of Clinical Endocrinologists for the management of such patients. But there was actually a program that concluded favorably called the Diabetes Prevention Program, which I'm sure you remember, and it showed that earlier intervention with metformin in those patients with prediabetes really did delay the development of diabetes.
That's what actually led to the current legislation and being able to get reimbursed by CMS. And so now those that are providing the diabetes prevention classes, and again, the regulation and where it stands is it needs to be the live and not virtual. But again, you can that shows that we're going in the right direction, because we have 30 million or so that have diabetes and another 86 million, so maybe 3 times as many that are in the pipeline. So if you think about the burden and some of these gaps that we're talking about, that's just the ones that we have right now, and 1 and 2 isn't above an A1C of 8. Think about what's to come.
Yeah, different communities have different problems, but almost every community has diabetes. When it comes to diabetes prevention programs, do you know who the #1 provider of a diabetes prevention program is in the country?
I know the answer to that question. It's the YMCA.
It's the YMCA. So there would be a lot of folks, interventionists out there, that would love to be able to see a more than $2,000 reduction, economic benefit, let alone the health benefit from it. And here we are talking about community as being this a really important intervention. So getting out in the community as practitioners, clearly important.